Meeting to order. First item on the agenda is approval of the agenda. The chair will entertain a motion.
So moved.
Thank you, Commissioner Williams. Commissioner Snell, all in favor will please say aye. Aye. Any opposed? Thank you. We are now up to public comment. Public comment is now open. Is there public comment? Last call for public comment. Public comment is now closed. I will make just this quick announcement that there is a special meeting of the Board of Commissioners at 1 o'clock today. So anything that can be done to move this meeting along with alacrity will be appreciated. First item on the committee items is approval of the minutes from last meeting. The chair will entertain a motion. Thank you, Commissioner Snell and Commissioner Williams. Any questions with respect to the minutes? Hearing none, all those in favor will please say aye. Aye. Any opposed? Thank you. And now the Health Department. Madam Director, we have a contract to address.
Yeah, good afternoon. Couple things, and I can be brief on most of these. First thing is to approve a medical director contract for a 2-year term. I do apologize for this coming in a little later than the contract start date. We ended up having to review some administrative changes on it, made some, nothing substantially of the actual work. We just had a lot of language in there that still said as an acting medical director. Should have probably been changed the last time around, but we got it fixed this time. Dr. Chernin has been our medical director for the past probably 5 or 6 years, and he continues to do the same and wishes to continue, and we wish to continue with him as well through May 31st of 2028.
Thank you. Chair will entertain a motion to adopt the staff recommendation. Thank you, Commissioner Snell, Commissioner Williams. Any questions with respect to the staff recommendation? Hearing none, all those in favor will please say aye. Aye. Any opposed? Thank you. And now, sorry, I have to kind of backtrack a little bit. The annual report of the Health Department.
Yes, our annual report for the year 2025 has been presented to you. It is our goal usually to try to get this out earlier in the year. The past couple years, just with some of our staffing changes and staffing elimination, it takes a little bit longer. I have nothing specific to go through with that, but we always make it our duty to present this to you before we place it on the county website.
Are there questions with respect to the annual report? We have a motion to receive and support. Any questions to the motion? All those in favor will please say aye. Aye. Any opposed? Thank you. And then it seems to me there was one more thing. Monthly report. Okay. We move from the annual to the monthly report.
We moved from annual to monthly, and actually this is a report of quarterly. The last time I was here was a couple months ago, but I will be back to the monthly cycle. But this report does cover May, June, and July numbers and information in there. Kind of most of our summer programming, kind of the end of our year, you know, I tend to be up here, talk a lot about kind of the school cycle and where we're at with schools when we talk about immunizations, health education, different things like that. Over the course of this time, right at the very first bullet on the very first page talks about how we respond to emerging public health threats, which over the last couple of months we've talked a lot, or we've been talking internally a lot, and the state has been talking a lot about the cyclosporiasis in communicable disease. I just want to make it known on here. We are, as of last week, I think last Thursday was updated, in Jackson we have 384 cases. MDHHS, though, has lifted the restrictions, or I guess it was an early restriction, but their recommendations to not purchase and consume bagged lettuce, back to routine lettuce guidance. Overall, though, since the end of June, kind of when things heightened with the cyclospora outbreak, we had up to 279 hospitalizations attributed to that cyclosporiasis outbreak. That takes our response, just to let you know what the health department's local response is every one of those cases that is actually a confirmed case confirmed by medical testing. Our communicable disease nurses does case investigation, contact tracing. We use the Michigan Disease Surveillance System. All of that information, some really intensive interview questions go into that. And then all of that gets funneled up through the state and then up through the CDC, where then their data collection experts analyze that to kind of find contributing sources and where those sources came
So
from.
did we find a source or sources
They-
within Jackson County?
No, none that even across the state, they're not identifying a 100% confirmed source, so. But numbers are going down. Where some of the reported sources were, the locations were, we're not receiving receiving produce from those locations anymore. There was at one point, there was a recall on Taylor Farms, but that is not, the FDA has failed to say that that's an actual confirmed source, because the testing because you'd have to imagine how many of that, like if you have bagged lettuce or heads of lettuce, how much of that goes out into the community. If that's already out, even though we're testing that at Borders and we're testing that in distribution centers, you have to do the test on the day that in that right piece of lettuce or piece of whatever it is that tests positive. So it's trickier than one might think. So confirmed is the key word there. They're not saying it's confirmed, but.
Okay, our hygiene discipline needs to be better generally, I suppose.
Yep.
Yeah. Questions for the director with respect to the monthly report? Tony?
Thank you. Recently, the government hearings interviewing Fauci, so many more questions, or so many things that people were questioning before. We now know certainly how the COVID vaccine had a great deal of harm. Do you still offer COVID vaccinations?
We do still offer COVID vaccination. COVID vaccines are still recommended for certain populations, especially in respiratory virus season. We follow CDC and everything recommendations on that. Yes, we can all speculate and we can all watch those hearings and watch things about what should have been done or what could have been done or how those things could have been done differently. Public health really operates in an area where we're trying our best at the moment to make the best decision in the interest of the whole. So at this point, COVID recommendation, and we don't, as far as the local health department, we follow MDHHS and CDC guidance for any of our immunizations, for any of our that. We don't have a local regulatory response where we would recommend or not recommend. We don't have the experts and expertise on our team doing their own scientific, data and investigation like that. So we follow the state and federal levels for those things.
Okay, thank you.
Okay, thank you. Chair will entertain a motion to receive the report. Thank you, Commissioner Snell and Commissioner Williams. All in favor will please say aye. 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 Thank you. Thank you, Kristen.
And if I can just follow up, just as I move back to the monthly.
Please.
Just, if there's anything in particular, any program in particular, I have some ideas I had when I went to that quarterly, but if there's any specific, program, any, of my staff that we can bring in to give you that information, please reach out, because, when I'm standing up here, my goal really is to try to, provide the most impactful information or the most educational information about what we're doing over there, so.
Okay,
Thank you.
Next up is Lifeway's quarterly report, and the CEO, Cassandra Watson, is here. Cassandra, good to see you.
Good to see you. Thank you for having me. I can be brief as well. So just some highlights here. I think at the last quarterly update, I identified that our recipient rights audit did have some findings, and we were in less than substantial compliance. We did hear back from MDHHS recently that our plan of correction complies with certification standards established by MDHHS for the promotion and protection of recipient rights. So our program is now in full compliance once again. Just some highlights of our agency activities are included. I just wanted to recognize that we participated in the Traveling Art Show with the Community Mental Health agency that is really our sponsor, the association that represents the CMHs. And so there is artwork that is shown on the pages of my report that are just all representative of why we do what we do. So all of these pieces of art are sold and they are produced by consumers of community mental health agency services across the state of Michigan. And at the end of this traveling art show, there's actually a competition and one of the artists is recognized at the end of it. So it's really neat. It's a really cool opportunity to see what we can accomplish and what the people that we serve can accomplish across the state of Michigan. Just important notes here that our regional entity, which is through how we get federal funds, Medicaid funds, does not have a contract still as of today with the state of Michigan. They have been notified as of last week that the state does intend to have contractual meetings, but usually this happens in very early June, if not late May. So this is very far down the timeline. Obviously, the contracts are effective October 1. So we are still waiting for some information about rates for services. So our budget, which will be presented to our board in September, will likely be made on projected rates. So we may have to come back with an addendum to that budget if it's above or below the 5% threshold. Another just keynote is that we've talked before about a request for proposals by the state of Michigan to potentially restructure the public mental health system, including the number of regions through which the community mental health agencies function. They did, and they being MDHHS, did post a RFP, a PIHP RFP on the DTMB vendor opportunities webpage. It was anticipated to be released in August. It still has not, as of today, been released. We have no details about what that RFP might include or entail. It could even be an RFP that is for the PIHPs that did not sign their contract in fiscal year 26, although it's our understanding they have now signed the contract and MDHHS has countersigned. So we really don't have any further information on what the state is intending to do related to how the regions are structured and how the public mental health system functions in the state of Michigan. And obviously we have new administrations coming in the new year. So we're hoping to have some clarity soon. And then just finally, the last note I'll make is that we did have, Lifeways did have our financial audit and our Deficit Reduction Act compliance audit. Neither audit demonstrated major findings. There are some things related to ability to pay that we need to make a little more robust internally, and we've already addressed those issues. So we're anticipating that there's no further action that we're going to need to take. So we are very proud of that. And with that, Mr. Chair, is there any questions?
Questions for Cassandra? Remind me, Cassie, when the millage is up in Jackson County?
We will be seeking renewal in 2028.
2028, okay?
Yes.
We always need to keep that front of mind.
Yes.
Yeah. Any further questions for Lifeways? Chair will entertain a motion to receive the report. Thank you, Commissioner Bear, Commissioner Snell. All in favor will please say aye. Aye. Any opposed? Thank you. Thank you and have a good day. And now the medical care facility, I believe, is next. Destiny's here. Thank you for being here.
Absolutely. Good afternoon. Okay, so we're going to jump right in. If you want to go to the next slide, and then one more, we're going to talk just a little bit about quality. So I did update the 5-star CMS 5-star rankings for Jackson County area and our market area, so it includes some out-of-county facilities. You can see that there's been a little shift from this from last month, but right now we're sitting at the number 2 spot for our star rating. On the next slide there, right now we have 4 stars overall, 2 stars in survey. And again, I think we talked about this last month, that we're capped at 2 stars for our survey at this time due to one of the citations we received in January. 5 stars in quality and 5 stars in staffing. So we remain one of 3 homes with 5 stars in staffing and one of 3 homes with 5 stars in quality. We have the lowest nursing turnover in our market area. Now you'll notice these numbers are trending up a little bit from previous months, but we're still maintaining a better turnover than the rest of our market area for nursing, and then also for RN turnover, which is trending up a little bit, but still the best in our market area. Moving on to finance. We have the financials for June. So revenue for June was $61,272 behind budget. Expenses were over budget by $32,604, giving us a net position behind budget by $93,876. Our census was down a little bit from where we had anticipated, and I'll show you that census trend line. But overall, even being down 2.5 bed days more than what we had anticipated, we're sitting in a fairly good position there on revenue and expenses. So year to date, revenue were $617,967 behind budget. Expenses are $443,503 better than budget, giving us a net position right now of $174,464 behind budget. Census overall has been down a little bit from what we had budgeted, but again, we've been able to offset that with some expense savings. On the next slide there, you can see our census trend line. So we talked last month that we've been seeing those dips. We've seen some recovery from our last dip down in census. And so we are back up above the budgeted census and hoping to maintain that until our next round of folks go home, and then we will recover from the dip once again. And then finally, for the additional financial narrative, right now our cash on hand has gone up slightly. We're sitting from last month at 11.7 days up to 11.9 days. So we are trending back in the right direction. We knew these months would be our tightest months as far as cash on hand goes. We do have our AR days outstanding are better than our goal of at 50 days with a goal of 54 days. Right now, we don't have any additional projected usage other than the bond interest payment, which will come in October, November to you for approval. Coming from the MOE, right now there is $5.5 million in reserves from the millage money that is held by the county. Any questions for me?
Commissioner Williams.
Thank you, Mr. Chair. So my question is just pertaining to census. So I was just curious, of the residents that live there, we have some that are permanently there, correct?
Yes.
Okay, do you know roughly how many people that is?
About 74%, so that's going to be about 140.
About 140. And so on average, it looks like we have, based off of the graph, I'm looking at maybe 180. Does that sound about right?
Yep. That's about where we're averaging right now this year.
Okay. All right, thank you. That's all I had.
Okay.
Nothing further, Mr. Chair.
Thank you. We had some funds set aside for some sort of billing that was going to come from the state. Have they asked for that as yet? Or are we still sitting on that liability?
We are still sitting on that liability. We are waiting for them to audit the 2024 cost report. They started the 2023 cost report audit in May, and we have not received a conclusion of that audit at this time. According to the timeline set in state statute, they have to close that cost report audit with no findings against the facility because they failed to do the audit within the proper timelines. So we're just waiting to hear if they're going to do 2024 this year or if that'll end up being next year. So we'll have to go through the audit process, and then there will be a period of time before the invoice comes.
But we've got the liability booked
Yes.
in the event that they finally get that billing to us. Okay.
Yes.
No, hearing no further questions, Chair will entertain a motion to receive the report. Thank you, Commissioner Bear and Commissioner Williams. All in favor will please say aye. Aye. Any opposed? Thank you.
Thank you so much.
Thank you, Destiny. We're now up to other business. Chair will entertain a motion to pay the claims. Thank you, Commissioner Williams and Commissioner Bear. Any questions on the claims? They should be down your way, Tony. Okay, good. All in favor will please say aye. Aye. Any opposed? Thank you. Please take note of other minutes that are in our packet. We are up to public comment. Is there public comment? Any public comment? Last call for public comment. Public comment is now closed. Committee member comments. Are there committee member comments? Seeing none, Chair will entertain a motion to adjourn. Thank you. All in favor will please say aye. Aye. Any opposed? Thank you. Thank you for speed today, everyone.